Hello, everybody. Today we're going to talk about COVID-19. This conversation is very special because we have an opportunity to speak with a person who experienced it from both sides. From the side of being a medical professional, a registered nurse who is working in ER, and a person who got infected by this virus, went through all stages of it, came out on the other side, and got complications. So being one person who experienced those both sides, she's going to be able to share so many insights and so many nuances that simply by the lack of time, a lot of even doctors don't have time to notice the details of it. And those details is what determines how the body is going to be dealing with this virus. My name is Bernadsky. I'm the founder of Untamed Hearts, and I am a friend of Leah Ilias. And our inspiration to create this video is because we want to empower people. We want people not to be afraid, but to be educated and to know what to do, when to do it, how to do it, and how to recognize and be in touch with your body. What you need to know about Leah is that she is 50 years old. She lives a very healthy lifestyle. She cooks her own food. She buys organic. She bikes to work every day, so she's very active. So for someone who is 50 years old, or anybody actually, she's just a very well-balanced, healthy person, and her emotions are well-balanced because she's been studying spirituality for basically all her life. So she has a way to stay centered, balanced, and grounded. Now, please let me introduce Leah Ilias. And I'm so happy that she came out on the other side. She won the battle, and she's very generously is sharing all these insights and tips with us today.
Hi.
Would you please share with us a little bit about your background, where you're coming from, and what happened?
Okay, so I just want to let you know, first of all, that I have 30 years of nursing experience. 4 years of that is been done in Russia. I used to work in the operating room and then in home care. Then I came to United States and I'm practicing nursing for 26 years. It was 2 places in subacute rehab. And for the past 7 years, I work in emergency room. It's 20 years total in my facility. So I have geriatric experience and I'm specialized on gerontology.
So what happened with you?
Okay, so I was working and I suddenly started to have some kind of pain in my back of the spine.
In an emergency room? Or?
Yeah, I work in emergency room, and then like about 4 o'clock, I work from 7 a.m. to 7:30 p.m. At about 4 o'clock, I suddenly start to have like sharp cutting off pain across the spine. And like I start to have difficulty to breathe, and I cannot take a breath. My lungs got tight. I cannot lift up my arms to hang up IV lines, and I was like stretching myself and trying to figure out what is causing it. It's like sharp and unexpected pain. And then I start to have some kind of dry cough, and I was thinking about, oh my, maybe I got the infection. So I barely made to the end of the shift, got home, went on the bicycle like I usually do. I go to work with bicycle. Barely got home, drink some tea, and went to sleep. And then in the morning when I woke up, I had new feelings. I had feelings of dryness all over my body. My eyes, I didn't have no lubrication. I couldn't even open the eyes and move it around. It's something new happened to me. I never felt it before. My nose was dry. My mouth was dry. Only the saliva when you swallow was there, but everything else feels extremely dry. I even feel dryness coming from the ears because I had the temperature, no sweats. It was very dry. And even private area, you can feel the heat coming from all the ears, all the holes, and you feel like such a dry heat. I had severe.
when you say heat was coming out, what do you mean? It was like higher temperature or temperature?
Yeah, I feel that I had a high fever. Usually if I was moaning a lot, like I was in agony pain. I know that when I have like that feeling it's a high fever, I didn't have any thermometer to check the temperature. I usually don't concentrate on my fever. I will explain to you later why. So I I was just thinking about what's going on, and I said it's something new feeling, and this is what I read about the COVID patient, that they are having dry symptoms. And then it's falling into the category of all symptoms what I read about, and I start to suspect, I said, maybe I have a COVID. So, and then I start to just do what I can do to help myself out.
What does that mean?
So, first of all, I start to recognize the process of the infection and how the body works on it. I know that the virus likes cold environments. And automatically I thought about, you know what, I'm going to try to keep the temperature as it is without bringing it down. So I won't let the infection to take over. I want the temperature suppress virus as much as possible.
So you were tolerating the high temperature without
Yes.
taking any medicine to bring it down?
Yes, I told myself, I just put thoughts into the mind that as long as I'm able to hydrate myself and urinate properly, I don't need to worry about my temperature because I have high tolerance to temperature and to pain.
Leah, but it's not okay for everybody, right?
No, I want to make sure that you understand that it's not for everyone. I have patients who come to emergency room after temperature 101, they faint. I have people who have seizures with high fever. I have people with different kinds of complications. You have to watch yourself and you need to know yourself. It's very dangerous if you practice like that. Usually it's recommended once it's go to 101 to start taking Tylenol.
So from the temperature 101, you need to make sure that you're watching it very carefully, and if something is off, take the Tylenol, right?
Yeah, no, I would recommend, especially people who has a chronic condition, and if your temperature is very high, even though I have a lot of patients whom I practice in the emergency room, when they come with temperature 103, 104, 105, some people, even we give them Tylenol, the temperature doesn't go down. It might stay the same way, or it might go to 102. It doesn't work much. So in the emergency room, we give fluids to help out to wash out the system and get people hydrated. At home, if it's go 101 and above, take Tylenol. Don't practice what I do. I'm just telling you my experience, what did I do, but it doesn't mean you have to do it. Please don't practice something what you don't know about your body. To me, it was the most important part to make sure that I hydrate myself, that I go to the bathroom, that my urine is light in color. If your urine is dark and concentrated and you don't urinate enough, it means that you losing the fluids. It could be through the sweat. Some people sweat. It's my experience. I was dry, but some people say that they were sweat so much they don't have time even to change clothes. So if you sweat a lot, it's going to perspirate through your skin. If you breathe too fast, it's going to come out through your breathing. You have to take in consideration not only urine, what you're going to excrete the fluid from, but also from the lungs and from the skin.
Okay.
So, but in order to make sure that you're not dehydrated, you need to look at the urine. This is the most important things to know if you're well hydrated or not.
Leah, I want to ask you something. When you take Tylenol, is it the only thing we can take, or not we, but people who might need it, or any other things that bring the temperature down and okay?
Okay, so according to the studies, what I heard about, that they don't recommend to take any medications by Tylenol because other medications are having a lot of side effects with this type of virus. They don't recommend to take any medication over the counter, like cold and flu, like NyQuil and Dayquil, because it has a lot of stuff which is not good for the virus itself. Don't take any Motrin, don't take any aspirin, no medication which has aspirin inside, water inside, like naproxen. Don't take those medications, please.
Tylenol only.
They recommend Tylenol only. And you need to watch the amount of Tylenol. If your temperature doesn't go down, please don't overdose yourself with Tylenol. It's very important that you follow the instructions on the container for the adult, not to exceed the maximum dose which is recommended. You have to take it. If your temperature, it's a lot of people whose temperature still stay high. You should not take too much of Tylenol because you're going to damage your liver. Please make sure that to follow the instruction on the container. It's very important to pay attention on that. The next things I would say with the symptoms, it was dryness, severe body ache, as I said, dry cough. When you cough, it causes a lot of headache. But cough was occasionally, very occasional, wasn't bad. Extremity weakness, joint pains. On the day 4, start to have diarrhea. Also on the day 4 or 5, I find out that I don't have sense of smell. Also,
and diarrhea every day, or
no, diarrhea started on day 4 and every other day, and it didn't have any cramps or any stomach ache. It just flushes when you go to the bathroom. It was pretty well.
Leah, at that time, did your like chest, lungs, back, did it continue to hurt? It's like the symptoms were piling up, or some symptoms were going away?
You know what, I didn't I didn't feel the pain of the back much. It was much easier, but I didn't do too much activities like I did at work time. It was difficult for me to get out. I wanted to sleep all the time, but I was forcing myself to come out from the bed to make sure that I don't have pneumonia, not to get the pneumonia. So I was trying to get up, make tea for myself every hour or two, move around, do breathing exercise. I'm going to tell you about that a little bit later. I was trying to eat as much as I can, whatever light food, like a soup, something light too, because appetite was bad. But I was trying to eat to make sure that I have proper nutrition, easy to digest, and to fight with the infection. I was drinking plenty of fluids, different kinds of fluids with a lot of vitamin C in the tea, lemon and honey, all kinds of remedies.
Leah, but was it like warm or cold? Like, because orange.
You have to make sure, that's important point. Thank you, Julia. This infection likes cold, and our American people are accustomed to drink icy water. So with this disease, we shouldn't give to the infection whatever it likes. We have to do opposite. We need to change our habit on drinking. It's really important for the all American people. Guys, we need to change our habit. If you want to prevent any complications, you have to drink warm to hot water. Not the boiling water to burn yourself, please. But warm water, not room temperature, but the temperature close to your body temperature. So when you drink, you have to feel that it's warm enough to drink it. And when you drink the warm water, you can drink it before the food. Drink it normal speed. Don't drink too fast. When you drink a little bit hotter water, do it during the mealtime or between time. And it's very important to remember to drink small sips. What it does, I actually didn't know about that before, but later I learned about that when I had complications. When you drink small amount of sips, small sips, and the hot water, what it does, it absorbs through your tissue, starting from the upper digestive system, from the mouth and through the esophagus. It gets to the cells, and then it spreads evenly to the whole body, to the entire body. When you drink too fast, it just goes from one end to another. We need to make sure that we lubricate and hydrate all the cells in the body. And when you do it with the hotter temperature than warm, it really helps to kill the virus as well. You're going to keep yourself in warm condition. You need to make sure that you don't stay cold. That's very important. If you have elderly people who is home and they're going to talk about what they need, they might be delirious because of the situation. Just make sure that they are dry, they are warm, that they are well hydrated. If they don't hydrate and stay cold, that's when the virus takes over. Then that's what it causes the complications. If it's an elderly person cannot move around, you have to turn them every 2 hours from side to side. You have to clap on the back. There is a lot of videos on the YouTube how to do physical therapy for the chest. You starting from the bottom of the lungs and going up to the top. Again, from the bottom on one side and then from the other side.
And that is to prevent?
It's to prevent pneumonia. It's very important. If it's person, if you can lift them up to sit up, let them sit up. if it's usually the young people and male adults, they cannot tolerate too much temperature. It's too high temperature. Some people report that they had temperature for 3 weeks of 104, 105. They come to the hospital very dehydrated. You're asking them, did they eat anything? No, I didn't eat anything. I didn't drink. I didn't eat anything. People losing a lot of nutrition which is stored in their and to prevent it. So it's very important.
Leah, you were frozen for a moment.
Yeah.
Let's just go back.
I didn't say anything. I just gonna continue. Whatever was frozen, I didn't give new information.
Okay.
So important is that we breathe, we move people. If it's a person who is sick, an adult with the normal capacity, try to get yourself up and move as much as possible. Remember that you need to prevent pneumonia. You have to move around. You have to do something, a little moving exercise, breathing exercise. You have to move around.
Yeah. So it's a light movement. It's not like don't go exercising, right?
No. Don't force yourself to go to the treadmill or something like that. No way, guys. Make sure that it's simple. You don't want to overdo because your body is weak, and I don't want you to do anything extra because a lot of people, especially elderly people, they get up with a fever without any support. You have to make sure that they have any walker or something next to them. I had a lot of patients who get injury because they get up from the bed and they lose their balance and they break their bones from the COVID complications because they are so dehydrated or delirious or they jump out of bed too fast. You have to take slowly. You have to encourage, if it's your loved one, your elderly people, your family members, you have to call and remind them, Mom, please don't get up right away. Take your time. We have to do a lot of preventive measures to make sure that people don't get any complications. Safety issue is number one. Also, I wanted to emphasize on the treatment what I did for the infection.
Can I just take you back for a moment? Can we just like regroup, like say once again in a very simple way so people just remember what needs to be done as soon as you suspect that you might have the virus. So you said one, you need to drink a lot of fluid, right?
Yeah.
And the fluid needs to be warm and maybe body temperature, maybe a little bit more than body temperature, but don't burn yourself, right?
Yeah. Mm-hmm.
So
you make it sip, like if you drink coffee or tea, people sip a little bit. This type of this is how you're gonna drink it, like a coffee or tea, but not 200 degrees when it's boiling and then you're gonna burn yourself. Please don't do it too much.
Okay, so hot. So the virus doesn't like hot; it likes cold. So we want to, in general, be mindful of keeping everything warm, and person who is having symptoms, keep him warm, even if it's even if he has or she has fever, right? Still, we cannot.
It depends also of the person. The person has a high fever and they feel hot. Of course, you're gonna let them undress and feel comfortable.
Mm-hmm.
But if the person, some people come to my emergency room, they're shaking, they have so much chills. So you should help them to warm them up until they feel comfortable, and then they can undress and open up. But at the moment when they feel chills, it feels they saying, I'm cold, I'm cold. I had a lot of people who coming with the cold symptoms, and we have a special warm blankets in the emergency room. We have a beer hugger, which lets us warm up the patient. And I noted a lot of people, even before we knew that it's a COVID, but with the same symptoms I see later on, who is already diagnosed with COVID. They come to emergency room with the low blood pressure, high fever, and no, temperature is low actually. Low temperature, low blood pressure, high heart rate. We used to suspect them for the sepsis, and they used to activate sepsis protocol and treat them for sepsis. And I remember placing these patients on a beer hugger, which is special blanket to give the heat through the hot air. And those people were staying there for more than 7-8 hours. Usually person who receives fluids, antibiotic, and all the necessary treatment, the temperature goes up. But in those cases, their temperature was 94, 94.3 for the whole entire shift. And I was questioning, why are they feeling so cold? I'm giving them double socks. I'm covering them with like about 5 or 6 blankets plus that warm blanket under them or on top of them. And they still feel cold. So I didn't understand, we didn't understand what is the process with the patient going on, but it could be that it was already COVID patients. Mm-hmm. So if the people, you have to look at everyone individually. If the person feeling cold, you warm them up. If they're feeling hot, it's their choice. But just make sure that you don't get cold. Even if you're sweating a lot, you need to change, but not to allow the sweat dry on you and then you fill up chills and then you're gonna get more complications. So just, you need to find the balance.
Leah, I have another question. I've noticed that, I remember in the hospitals, they always give you like cold water or water with ice. Any comments on that?
It needs to be changed, I believe. We have to introduce warm water to patients and hydrate them as much as possible.
So it's good for people to know to ask for warm water or not to drink cold water, let it warm up somehow, right? Or
I hope, I cannot say anything right now. I don't know, maybe people need to, I cannot just talk about the facilities. Hopefully they will look into that. I'm not at work right now to do anything, but I hope maybe they will find out some kind of devices to make it safe in the facility so they can get, like we have a filtered water machine which is getting ice and water. Maybe they need to make some kind of device which is going to provide warm water, not to burn people.
But the bottom line is that people need to not drink cold, but drink warm. Even if you're in a hospital, be aware of it, right? Drink warm.
I don't know if it's advisable to, if you have any bottles like that, to take it with you if you go to hospital and dress up properly. Maybe to send per patient, if you're sending your loved one to the hospital, don't put on them jeans or any clothes which has metal zipper or any buttons. Put them in sweatpants, like some kind of clothes that doesn't have anything metal. So when they come to the hospital, if you undress them, they might become cold and chilled. To go to the radiation, to radiology exams like X-ray, CAT scans, MRI. So if you have a normal soft clothes without any metal, you can put a gown on and you don't need to be undressed to get the procedure done. So it's one of the issue, warm socks, because people are really losing the time through the changes and can become more cold at that time.
So to make sure that we have everything we need for the person to stay warm, right?
Yeah.
Okay, so now you said, just to focus these points, you said that it's very important to move. So even if the person, like with COVID-19, there is extreme fatigue experienced by most of the people, or by a lot of people, right? So even if the nature tells the person to just stay in bed and don't move, it's very important as a prevention of pneumonia to move the body, right? And to breathe deeply. And you will share with us
how to do it.
How to do it. Is that right, Leah?
Correct, absolutely. You know what, if the person, even if the person is very weak, at least sit up in the bed, at least move from side to side and breathing exercise. But you need to get out to make sure that you drink and pee. Just make sure that you're peeing right amount of fluids and that your urine is light in color, and just emphasizing over and over. This is very important. Okay.
And the reason for the movement is to create circulation in the lungs, right? So that nothing stays in there.
Right, in the lungs, and also just not to lose any, it's also to prevent pressure sores. I'm a healthy young person, but when the fever is high and my body becomes so heavy, even lying down 2-3 hours on the bed, I feel like it's like soreness already on the sides. It's like you don't want to move. It's so painful. You feel like a heavy stone.
Okay.
So those things will prevent any breakdown of skin, especially if it's elderly people. They will break up easily. So we need to take into consideration those things. Movement is important.
Movement is important to prevent complications, to prevent pneumonia, and to prevent problem with the skin. Is that right?
Correct.
Okay.
Uh, okay, so a few more tips I want to tell you. Once you have a first symptoms, it's a very good effective treatment. If people do those things right away, usually I see a lot of friends who start to have those symptoms. I give them the tips, in 2 days they recover.
Wow.
So just want you to know, everybody has a blow dryer at home.
Mm.
If you have, I don't have with me, if you have a water spray bottle, if you don't, you can use any water spray from the whatever you use in the household. Just make sure that you wash it well.
So it's not chemicals. There's no, right?
Yeah, you have to make sure there's no any chemicals. You have to really wash it well, and then put inside the any eucalypt oil or oregano oil, any kind of essential oil which is antiseptic. You can use and it also has a smell, and it's gonna help you to breathe in. I mean, preferably to have the fresh bottle, not to use any chemical.
Oregano oil, eucalyptus.
Yeah.
And there are different.
I have those one. I'm not sure if there is any other kinds, but probably.
On Guard is really good by doTERRA. On Guard by doTERRA is amazing, antibacterial, yeah.
So those one, you put it in the bottle, you shake it well in the warm bottle, and you spray it on your face around the nose.
Mm-hmm.
And then you're just gonna put the blow dry right to your face. What it does, when you get the infection, the virus enters through the eyes, through the tears duct, and through the nose and through the mouth. So what you need to do, you have to blow the hot temperature blow. You go like that. If you put it on the low speed, and just breathe it. And everything what you do, put the consciousness on it. You have to understand how it's work and why do you do it, so you will tolerate it differently. If you just do it something, it's like without any understanding about that, of course it's going to be more harm. Just make sure that, okay, I'm trying to kill now the virus. Actually put it in the low temperature, in low warm, than the big speed, because if you have dryness already from the beginning, you might over dry your insides. So that one you're gonna do like about 5 minutes several times a day.
How often? What do you mean several? So like I do 5 minutes and then I take a break, or
break like about 2-3 hours later, do it again.
So 5 minutes, 2-3 hours break, and then 5 minutes blowing on your face.
How much you can tolerate? If you can do it 2-3 minutes, okay. If it's 5 minutes, it's enough.
And the hair, and did you say that it's on the highest or in the medium?
You know what, medium is better, because highest, it depends also how big it is. Some people have a very big size, it can be too much.
Just be careful. Don't
you have to feel not to burn yourself. You have to feel how to adjust it. Maybe you need to, it depends of the size of the blow dryer. This is a child one, so it doesn't blow too much. If you have a big one, you have to adjust yourself. Maybe go too far away from the body and see, you're gonna feel very warm and nice feeling.
So Leah, the point of it, the point of it is to what? To warm up different areas on our face, to introduce heat to different areas in our face, and we applied oils to it, and we applied heat.
Not exactly oil, we apply spray with water, not to make it too dry. We spray to prevent dryness more. And also it inhales. When you do the eucalyptus, it's going to inhale to your lungs and help your lungs to open and breathe well. Don't do it too much. You don't want to over dry your inner mucosa of the lungs.
So let's just redo this just to make sure that people understand it correctly. So first we take a bottle with water. Stop. Correct me if I'm wrong. We take bottle of water. Put if people don't have oils, it's okay. Just water.
Just water.
Okay. So either water or water with some essential oils that will help to open up as you breathe in. Essential oils could be oregano or eucalyptus, and there are others, but those are just examples. And then you spray where? Like here and here?
Around the nose. This is the most important part. The area doesn't get too much dry, yeah.
Okay. And then we hold the blow dryer away, and everybody needs to be smart about it and measure how far. We don't want any burns, and measure the temperature that you can tolerate. But the idea is that this hot air will heat up certain area in our face where we're most susceptible and where the virus might be residing at the moment. Is that right?
Correct.
So we want to kill the virus because it's afraid of heat. The reason why we're using the water and the oils to create a little bit more tolerance for our skin and to give it a little bit more moisture.
Correct.
Is that right?
Yeah, it's correct. Even if you don't have a spray, you just can get a little water and just
so you can just tap it. Okay, so we don't have to complicate it. So we can just tap the water a little bit and heat it up. And how often we do it? We do it for 5 minutes, preferably, right? Yeah. If you cannot tolerate 5 minutes, do it less. But the idea, just give it as much heat as possible, right? As much
you have to also look at your body temperature. You don't, if you have body temperature, you don't want to do too much of that one because you're burning yourself from the heat.
So Leah, are you saying it's a prevention? So the moment person feels something is off, to start doing this?
Yeah, if the person, let's say someone complains of itchiness in the throat or something, so right away have in consideration, I might have that infection.
Okay.
If you have any itches in the throat, any kind of dry cough, you don't know what you have. So don't play around. Just start with this one. This is the first things to.
Don't take chances.
Yeah, don't take chances. Start with this one. It's helping so much. You can get rid of the problem very fast.
So in other words, correct me if I'm wrong. I just want to make sure that I understand it, and then maybe people will also have these questions, and it will help them to understand it well. Because I'd like to really know why. And so is it because the COVID-19 first stays around the mouth?
It comes into our body through those holes. Okay. We rub our eyes, it goes to the eyes. And then if we inhale, someone sneeze on us, or we are in an environment where someone went through and didn't have any mask, so it stays in the air. People with the COVID, it's very rare people get any sneezing. It's a dryness most of the time. I work in the emergency room. I didn't see people coming at the beginning when the people were coming with those symptoms. In my days, I didn't see anyone who asked me for tissue. I was saying to myself, I said, usually with the flu, everybody has a tissue. They ask me, can you give me tissue? We used to give right and left.
Okay.
With this experience, when I see these people coming, nobody complains. I had few people who were just coughing some secretion, trying to get it out, but no wetness.
Okay. So the reason for this, to do this, is because we want to prevent the virus from entering the body. We want to kill it
entering to the lungs
before it goes down. So how long does it stay on the top of the body?
I don't know, and we just want to make sure that we do every preventive measurements.
This is preventive measure.
Yeah, we recognize right away the symptoms, and we do everything to mobilize and attack and say we are ready to fight.
Yes.
So
and introducing heat, trying to heat up all the cavities from the outside, right?
Your body gives it from side and you do it from outside. We have to make sure that the heat coming from everywhere. We have to attack it as much as possible.
Right, and we have to be careful if the person already has temperature, and every single person is very different tolerance, different reaction. So we need to be very careful about this. But this is just, if you are okay, as far as like tolerating it, this is a great prevention, you're saying, right?
Yeah, if the person has a high temperature already, everybody's different. But most of the time we have symptoms at the beginning. Like I had before the temperature, I had a very back pain. If I wouldn't be at work, I would be able to do it right away. But if I went home, I didn't know about that actually. You were the one who gave me the video, and I started to do it on day 2.
Yeah.
So if you know about that, if you do it right away from the beginning, it will help you out.
Do you think that even if people don't have symptoms, but they know that someone in their household got COVID-19 or they suspect they have it, they should do this as well?
Don't do until you have symptoms, because some people don't have any symptoms at all. My son lives with me, even though I was trying to stay away from him. But anyway, we were crossing out in the same bathroom, even though I have my separate utensils and everything, but still it was in the air. He didn't get infected. He didn't have any symptoms.
Okay.
It's a lot of family members. I know some people have a whole family sick, but I know families where they have 5, 6 kids. Only one person is sick. The wife had it light symptoms and it's gone.
Okay.
Everybody is different, so don't do any too much measurements, preventive measures if you don't have any symptoms. If you start having, do it. If you don't have any symptoms, don't get yourself crazy and scared.
Okay, and that's one of the points that we want to make for people to please don't panic. Please don't be scared. Just be observant of what's happening. And because stress is a big, great friend of the virus, of coronavirus, and stress makes it worse. So we need to stay very focused and not be scared, but know that there are things that we can do immediately. Just be in tune and in touch with your body as much as possible.
And I want to add one more. Yeah, I'm sorry. Just wanted to give you one more information how to do the steam inhalation.
Okay.
This is very important for those people who has a very dry secretion inside. So if you can do also wash your nose with use the hard soap, not the liquid one, no antibacterial soap, please.
So the soap bars?
Bars, one second, if I have it here.
But it's any soap bar basically, right?
Yeah, any soap bar.
Oh, okay.
So just make it and wash a little bit inside, rinse it out. You can put a little salt water if you don't have the sea salt water. You can just make sea salt in the regular water, mix it, and you can peep it inside of your nose. The virus. And also, I was doing the steaming. I take the pots, I boil the water, put it on the table, use a little bit of baking powder, put it inside in the water. Take a little something to cover yourself. Make sure that you don't burn yourself. You cover like that. Cover yourself all the way down, not to get the cold air in, and then you breathe over the pot. Don't put your face down. You're gonna burn yourself. Right. You just take it on the side like that. You find the way how close for you it is, and then you cover yourself and you breathe it in. What it does, it's gonna it's gonna evaporation. It's gonna soft up the baking powder. It's gonna soft up your breathing. Everything what is dry is gonna lubricate the site. It's gonna help you to have to be lubricated. It's gonna kill the virus. It's gonna open up your lungs. It's recommended for people to prevent pneumonia as well. It's gonna be easy for you to breathe. But if you have a high fever, usually they say not to do it. Again, it's everybody's different. You need to pay attention what is best for you. You have to look at your symptoms. You have to try. If you like, I had a high fever and I was still doing it. But it's set up of your mind. Everything, consciousness is everything. You have to try to do what you can do. Don't force yourself, please. You have to know the balance, when to do, when to stop. If you can do it, do it. If you have Tylenol to take, if the temperature is high, let the temperature drop and then you do it. But I was doing it every day at nighttime.
At nighttime only?
Yeah, before sleep. Don't do it through the day, because you need to do it. You need to sleep after that. You need to go to sleep after that.
You can do the blow dryer during the day.
2 times a day, and then this one at nighttime.
2 times a day?
Few times. Yeah.
And then before you go to sleep, open everything up with the inhalation.
Yeah.
And what about shower?
Not on the first days when you're having fever. You can take light warm temperature water, but don't make too much heat, because you don't want to give more temperature to yourself. You don't want to increase the temperature, because you can burn yourself out. It can cause a lot of complications. Just be careful. When your temperature goes down, yes, use the steaming room, sauna if you have in the house. If you have you can even soak yourself in the bathtub with the Epsom salt and eucalyptus, whatever you have, just to warm yourself up. If you feel cold or if you don't have any temperature, yes. But if you have temperature, don't do it.
Leah, and one more question. I know you're tired. I just want to, I want us to give like a full overview. And just one last question. What about nutrition? Like, I know you've mentioned that you ate, right?
I was trying to eat all the light food, like chicken soup, something light, not too heavy, no breads.
No bread.
No bread, no milk products, because milk products they causing mucus formation, and it's you cannot.
Sugars?
Sugars, yeah, sweet stuff, a lot of sweet stuff, because some people don't want to eat, but drinking is important to have at least you're getting so much energy on healing. It's okay to drink a lot of sweet stuffs and get energy from sweets.
Like honey and
Honey, I use agave syrup, whatever you have sweets, whatever you can eat and drink, whatever. A lot of vitamin C. It's very important that products with vitamin C, lemon added to your tea. I have sorrel drink. Some people know about that. It has a lot of vitamin C. If you can eat oranges, like small pieces of oranges, greens, if it's allowed for you, maybe add it to the soup. Eat garlic, eat onion. This is all anti-inflammatory medications, natural stuff. Also, I would suggest to do very simple recipe, anti-inflammatory recipe. I did some research on that. If you take honey, any raw honey, or preferable manuka honey, you mix turmeric or curcumin, we call it, powder. You mix 1 teaspoon of turmeric with honey, 3 teaspoons. You mix it up together. It comes out, I put it separate, it comes out to be like this consistency. It depends of the honey, if it's liquid or whatever condition. So what you do, what it does actually, it's antiviral remedy, and it's also helps to work on the body as antibiotic. It's actually, they have so much research on that. It's actually helps whole body to take care of different kinds of, even to the wounds. It's inside any ulcers. It's for asthma people, for different kinds of problems. It's very effective. What you need to do, you need to use only 1 spoon, but a day. How you do it? You take a little amount.
Full
For
teaspoon?
the whole day, 1 spoon is enough. Okay. What you do, you see that small amount? What you do, you just lick it. You put it in the mouth and you lick it and you let it play around your mouth. Our mouth, especially under the tongue, there is a lot of big vessels which helps to absorb quick. Like if a person has a heart attack or ischemia, you take the nitroglycerin under the tongue. You put it in and in a few minutes pain disappears. The same effect you're gonna have not to eat, because it loses all the ability when it goes to the stomach. When you put it in the mouth like that, just move around.
It dissolves.
Hold it as much as possible. Play around, and then you swallow. Even if you swallow, it's going to be going to the walls of your. But be careful. If you have a problem with swallowing, I don't want you to choke. Just make sure that you play around as much as possible and swallow. That's why it's important to take small amounts.
Just
and
so until it dissolves, right? As much as possible. And so
through the day, 1 spoon a day is enough.
So you can take a few times, but by a little bit, but
a little bit, yeah, through the day, a little bit through the day. But if it's manuka honey, is the best. Any honey is as much as it raw. Even if you don't have raw, it's better than nothing. Use it. You can order on Amazon the turmeric. Also, one of the good items is it's called GCE. It's a grapefruit seed extract.
What is that?
It's a big amount of vitamin C. It's anti-inflammatory agent. It's a natural anti-inflammatory agent. I just find out about it. I just received it today, so I start using it today. But you can order it also. Vitamin C. Important to take vitamin C. I used to take 1,000 vitamin C. I think if you take 2,000-3,000 milligrams a day at that time, it might help you. there is a lot of information now that they recommend to take a big dose of vitamin C to prevent it getting any worse. So those items are very helpful. Also, before you go to sleep, after you finish to do all the stuff with the nose, I would suggest for you to take any oils. Like I brought from India last year the Ayurvedic drops for the nose. It's for the sinus, all kind of stuff. So I have a drop, I drop it every night. If you don't have those kinds of oils, you can use anything. You can use olive oil, even what we eat. You can use coconut oil. You can use any kind of oil you want. You just lubricate. Right? Yeah, even the Vaseline, just to prevent dryness, you have to lubricate your nostrils inside to make sure that they're moist.
So this virus likes it dry, right?
It makes everything dry. It's making our body whole dry. It's causing the dehydration. So we have to make sure that we do everything to fight it back.
Okay. So Leah, just about the food, everything you said makes me think that what you're saying is that the food that we need to take inside is anti-inflammatory. So there's certain foods that I know that are more like not opposite of that, like tomatoes, eggplants. Should we think about that at all, or?
You can still use tomatoes. You can put it in the soup, whatever you like to eat, but not the heavy food. Don't eat any heavy rice or pizza or
no pizza.
Heavy meat. Yes, something like, because your body needs to get all the energy to help immune system to fight with infection. If you overeat, and especially it's affected a lot of digestive system, you don't want the digestive system to be overwhelmed and have complications. Okay. So it's very important. Most of the people don't want to eat.
Okay.
Just lie down and they say they don't have any appetite. And I'm going to tell you also about other things to be in mind. I didn't know that I lost the test of sense. When did I lose it? I didn't know until I had the complications. But you have to sense of taste. You have to,
sense of taste. You didn't taste the food.
I realized it later on when I had complications. I didn't know when it started, but I want you to know, all of you, from the beginning, every day, once you start to have the symptoms, try to see if you have sense of smell and sense of taste, I'm sorry. So it's important, because if you don't know that you don't have a smell, you might have a lot of problems as a safety issue in the house. I left the other day food in the oven and I forgot about that it was on high temperature. When I realized, I saw that it was all burned. It didn't have any smoke because it was a high lid, but I probably, if I have a nice smell, I would be able to smell that it's burning. I didn't have any idea that it was burning. Okay. My son was inside, locked up in his room, and I'm here next to it, and I didn't know anything about it. So it's very important that everybody needs to check their smell, use the perfume or something to make sure that you know if you have smell or not, and be tuned into it. If you put cooking something and you have a fever and you went to sleep, I don't want you to burn yourself out in the house. You really need to go and put the alarm maybe on your watch, or maybe set up the kitchen oven to make sure that you have a timer to set up to stop it.
Okay.
Those people who doesn't have a taste, it's also important to know about that, because it's few reasons I want to tell you. I noted that a lot of patients coming to emergency room fully dehydrated. And when I asked them, what did you eat? What did you drink? What happened to you? They said, oh, I didn't eat or drink for 2-3 weeks. Those people are extremely dehydrated. They look very, the faces sunk, eyes sunk. They look like they lost a lot of weight in 2-3 weeks. When you give them fluids, they urinate small amount of urine, very dark in color. And then sometimes they recover, and then they say, can you give me food? I'm so hungry. I bring them food and they like try a little bit. They were begging me. I order extra food to come for them in a different time than it's served. But when those people eat the food, they spit out and they don't eat. And I didn't understand until I get the symptoms myself. So it's very important to know. If you know that you don't have any taste, just try to see, put any spices and see if you feel it. Like I don't have no feelings. I don't know what I'm eating. I can eat onion and garlic. I don't know that I'm eating onion and garlic. I don't have no bad test. I don't know what I'm eating. So if those people come to the hospital and they eat food and they spit, they probably think, what kind of cook doesn't know how to cook? So, but if you know that this is a symptom that you don't have any taste, you will have to set up your mind that I have to eat to get the nutrition, because if you don't eat, all the body, which whatever is stored in your body, you're going to lose all your vitamins and minerals, and you're going to have so much complications from not eating for a long period of time. Don't forget, it's not just the fasting when you're healthy. This is, you're losing a lot of energy and temperature and so much toxicity going on with the virus. You want to make sure that you have yourself properly hydrated, properly nutrition. So if you know that you don't have any taste, try to eat. Like I know now that I don't have any taste. I eat, it's tasteless. I don't know any taste, but it kills my hunger.
Right.
It kills my hunger, and I know that I get a lot of nutrition.
Right.
So it's very important to be aware about that. So keep in mind, please. This is like important tips for you to know.
Amazing. My God, thank you so much. This is a lot of information. Is there, I think we're going to take a break and we're going to regroup and we're going to record another video, because I know that there's so much more you are able to share, you want to share, and there's so much more for people to know about this and your experience as well. But before we wrap up this conversation, did we miss anything? Do you want to add anything to this?
Run through quickly my notes to make sure that I miss anything.
The notes.
Oh, breathing exercise I want to add.
Okay.
The way we breathe, guys, it's very important to keep in mind that first you need to exhale. You have a lot of videos on the internet how to make a breathing exercise. I watched several of them. They are all good. You can use those exercises, but just keep in mind to start with the exhalation. The reason we do it, we need to empty the lungs first before we inhale the fresh air. If you come with a cup of tea, if it stays too long outside and then you come back, you don't want to drink this tea. You go, you empty it, and you get the new cup of tea. The same with the lungs, you empty it first. So the way I was told to do it, and I'm doing it, it's this way. I'm going to try to demonstrate. You have to concentrate on exhalation, not an inhalation. Try to do it in sitting position, because I don't want people to get dizzy and faint. Some people can have a light dizziness, and it's for a short period of time, then it goes back to normal. So concentrate on the exhalation. The exhalation is going to be long. Inhalation is short period of time. Don't think about inhalation. More on exhalation. The way you exhale, you have to bring your stomach in when you push out the air. And when you inhale, your stomach needs to pop up a little bit. So when you do exhalation, you go like that. With the sound shh. So you're going to go like that. Look at my arm, how it moves in, so you'll have some idea. You see me well? Can you see me well?
Yes.
Okay. So you start, just put a thought into your mind that you start with exhalation. You start like that. And then you go as much as you can. It's a little bit difficult for me now. You do it several times a day, no less than 4 or 5 times a day. If you can do it every 2 hours, it's excellent. Don't do it right after the food. Like before and right after the food, don't do it. Like give 2 hours space. And when you sleep, obviously. So those kind of exercise, if it's difficult for you to do this way, do the way you like to do, but exhale first. Try to do it by the window, by the fresh air, especially if you don't know your smell. If you don't have it, you might have some odor in the house because it's not empty garbage or anything. So don't do inhalation somewhere, even though you don't smell it, but you will inhale something dirty in the house. Try to get close to the window and do it there. Put the chair, please make sure that you're safe and do it proper way.
So Leah, when you said that people who are maybe very weak, and they don't want to get up from the bed,
They
they
can
they
raise
need
up
to do
the head of the bed, move it up to the head of the bed, so you
and
can raise up and do it there. Yeah.
thank you so much.
There's so much things. Hold on a second. You know, keep your window. You have to ventilate your rooms. Coming out from one room to another, you do that. I have at home from Russia. It's quartz lights. I disinfect the rooms from one room to another, but they don't sell those things in the United States.
Ionizer might be good, right? Air ionizer.
I don't know about that. It's a special device I use. I don't have it right here with me right now. It's like in the operating room. They put the quartz light and it kills the old germs. So, but you have to do it if you guys have it somewhere. If anybody listening to me from Russia, you should do it the way it's instructed in the manufacturer. You cannot stay in the room. You have to wear special eyeglasses when you put it on. You have to come out. You keep it in the room certain amount of minutes, what is recommended by manufacturer. And then you have to open up the doors and windows to make that room to ventilate. You cannot stay in the room even after that, because it can cause later on cancer in the human body. Okay. You have to be away. So, but that product can be used to kill all the germs in the entrance when you come out from the outside, to kill everything in the clothes. So that stuff I use at my house. But in America, we don't have it yet. Maybe it will be created. I heard one doctor was talking about that on the news. They were suggesting to create those kind of stuff, but hopefully it will be in the future.
Okay.
So a few more things. What did I want to say? Let me just check.
While you're checking your notes, I just want to add, guys, that one of the ways to kill bacteria and to disinfect the air is essential oils and using diffuser. I use doTERRA and I use On Guard, so that's also very helpful to use during the time of this coronavirus. I don't want to use, let me choose the right word, the battle with it. So one of the ways to disinfect the air is to use essential oils. And there are a few different oils that you can use, but just keep that in mind, that it's really good, and really good when you go to sleep to put it by your bedside and just run it around your house to make sure that whatever is in the air, it's being removed.
A few more things, two more things I will add. So from the beginning, you can do those things once you start to have COVID. After you take a shower or whatever you do, take regular onion, piece of onion, you slice it up. And what you do, you attach the onion, the slice of round onion, you attach on the sole of your foot, you know, between the heel and the toes. You put it on top and you put socks on.
Soft part of the foot, right?
Yes, sole of the foot. Yeah. Maybe later on we will post some pictures in the website to see what it is. What it does, it's first of all, they say the onion absorbs all the virus, all the infections. Mm-hmm. And also some people use it in the room just to keep it on, to absorb all the infection. But it's better to use it on the feet because it sucks out all the inflammation, even though we don't see how the energy works, but it helps to suck out everything from your body and stay there. I use it a lot.
You sleep with it, right? You sleep
you have to do it at bedtime when you sleep, not through the whole day, only at nighttime. And one more thing for the cough. We have here the spot. It's good to circulate this area. It's like point area. Pressure point, I'm sorry. You do it for 2-3 minutes, very hard. Do it like that.
And how do you know which point? Does it feel more painful?
You know what? It's going to be painful. It was recommended for me by one of the professional who is homeopathic, using homeopathic medicine. So he recommended for me to take this point pressure, do the pressure point in this area on the left palm, guys, under the big thumb. Okay, left one. You need to have neither the tape or the bandage and flaxseed. I use this flaxseed. You can use any flaxseed, whole or crushed one. I don't have the crushed one. What I do, preferable that it's raw, not the how you call it, processed one. What you do, you take the tape, or the bandage. You put a little bit of this, it's a little bit messy, I'm sorry guys. You see, you put a little bit of flax seeds. I don't have the whole one, so I'm using what I have, but it has the same effect. And you attach it like that. This is the point where you're going to attach it. So it also helps to help out with the cough and relieve inflammation.
You just leave it there. You
go to sleep with that. You go to sleep with it. You can put another tape to hold it more, and you go to sleep with it. In the morning, you remove this one and the onion, and you wash your hands and the feet, and you move around.
Is it also anti-inflammatory or?
It's also anti-inflammatory. So those things, it's homeopathic remedies. We use it from the beginning. If you start to do those things, guys, it's going to be 1-2 days and hopefully recover.
Much better results, right? It's the way to support the body to win this virus and to have I think the way I see it, and Leah, correct me if I'm wrong, the way I see it is that if we notice it early enough, we can prevent it from entering different areas of our body. We can keep it at the gate, kill it at the gate, not let it in. Or if it's already inside, we need to get our body strong. We need to move. We need to eat anti-inflammatory. We need to use anti-inflammatory different methods to prevent the virus being strong inside of our body, right?
Correct. We have to do everything. We need to know all the strengths of the enemy. We need to have all the strengths of the enemy. If you boxing, you need to know what is the points of that opposite person. So you need to fight. You need to learn to touch all the weak points of that. You need to know strengths and weak points.
I love what you
make sure that we press on all weak points and we don't let them to go and attack us.
There you go. So the weak points are, it doesn't like heat, it loves cold, right? It likes inflammation. So we want to introduce anti-inflammatory. It likes not to have movement in the body, no circulation. So we need to move. We need to, like, our lungs need to be active and awakened all the time, right?
Yeah. So it's a combination of everything, guys. Like you said, important things to remember, that we need to have a positive thoughts. We should not be afraid of this infection. I didn't have any fears from the beginning. I know that I'm working the field where we have to be people who doesn't afraid of anything. But also, as you as a human being, just be aware that it's all temporary. You're gonna go over it. If you do get scared, you're throwing so much stress hormones to your system that it's gonna cause your immune system to go down. And initially, if you will have the infection pass through you, you will catch it up and get it stronger. So just make sure, listen a lot of beautiful music, know about these symptoms, how to treat. You're gonna have this information always available. You can go back and look at the source and see what you can implement in your life. Don't be scared. Try to do as much as possible to keep you alive. Some people, I understand, sitting home and getting angry that they're losing job, they don't have money. We're all going through some kind of loss and changes, but you know what? So many people lost their loved one, and I don't want you to be the one. So even though you're losing money right now, think about what blessings do you have, that you are not there fighting for the life. You are not there dying.
Focus on appreciation and great, right?
That's important things, yeah.
And positive, as much positive as possible, because stress, it's another friend of this virus.
Yep, that's true.
So let's do everything that we can to keep the body, to give the body everything it needs to win the battle.
Yeah, and then pray, guys, and meditate and be doing from our part. We have a lot of friends, we get together and we meditate and we send so much energy of healing to the whole universe. Everybody, I know that all communities are working together now, and people from church, thanks God we have Zooming now, we have so much programs, people get together, so many people get involved now, so much volunteering going on, people doing the great job. Whatever is going on in New York, I'm blessed to see people getting together, not only in New York, people calling me from all over the world.
So focus on the good. Focus on the
Focus on the good part of whatever is going on. We want to make sure that you know it and you do it and you're gonna get it over. Everything is gonna be over soon, guys.
Leah, thank you so much. Thank you. We can have this conversation forever because there's so many details and nuances. So we promise we are going to come back. We are going to record another video, and Leah is going to share more insights and perspective from the perspective of a nurse and from the perspective of somebody who experienced it, and she will give you more tips and advices. Leah, thank you so much for all the information, for all the insight, for your energy, for your love, because I know that you are still struggling and you're putting yourself out there again and again and again for all of us to receive this information, to have this knowledge that you didn't have before. You didn't have it. If you had it, you might have gone through it much later. So thank you for putting all of us first before yourself. But now I want you to take care of you. Please go to sleep. Please take care of yourself. Take care of your body. And we will continue this series. You can leave comments and we will summarize and address questions in the next video. And thank you so much for everyone who joining us. Thank you so much for everyone who is listening. Thank you so much to everyone who is sharing, because sharing this information with others, because this is our way to contribute to winning this battle.
Amen.
Thank you. Thank you. Thank you. Thank you.
You guys.